recurrent inguinal hernia for the past, had surgery 30 years ago. He's legally blind, has cataracts, and the patient had mechanical heart valve replacement and is in warfarin. He's planned for an operation, so we should stop warfarin, and the patient is very anxious and already had a consultant clinic, but very worried to stop warfarin. Will you be able to speak with them and consult them about the warfarin, if that's okay?
Shall I enter?
Yes, please.
Okay. So I'm entering the station, washing my hands. Okay. Hello. Hello.
Hi, good morning, doctor.
Hello, good morning. I'm Dr. Hemant. I'm one of the surgery candidates. So I have been informed that you're having some concerns over stopping the blood thinner you're already taking.
Yeah, doctor,
So I'm
correct.
here to talk everything about it.
Yeah, thanks
So
for
you
coming to see
can,
me.
thank you very much. And so I'm here to explain everything about it so that we'll okay. So shall I just so what do you I heard that you already met the consultants. So may I know what do you know already? What you have been told so far about this surgery and stopping this blood thinners?
Yeah, so doctor, I had a stroke multiple years ago, and I was started in warfarin, and I've been told by the stroke doctor never to stop this medication, because if I do that, I will be likely to have another stroke. The reason why I take it is because I have a problem with my heart that's able to give me multiple strokes. So I need to just continue it. So your consultant said to me that I should be stopping it, which does not make sense to me, because basically you're trying to give me a stroke.
Yeah, I totally understand that. I understand your concerns. And so okay, first, okay, shall I let me explain about this scenario first? Okay. So so this is a warfarin is a medication that is usually used to thin the blood. So and so it prevents certain products in it will prevent the production of certain chemicals that is needed to form clots in the blood. And in case you've been prescribed by your warfarin by your heart specialist that you undergone valve surgery. Are you with me so far?
Yeah, to be honest, I know a lot about warfarin. I just
Yeah,
don't
yeah, yeah.
understand, why do you want to stop it?
Yes, yes, I'm coming to that. So if you have any doubts, you feel free to stop and ask me any doubts. Okay. So
Sure.
this warfarin is having a longer period of action. Like if you stop it today, so it will continue to act for the next 5 days, even if you haven't taken that dosage. So what happens during your surgery, which has been kept? So we usually stop this warfarin 5 days before for the fear of losing a lot of blood during your operation, because your blood is still thin during the surgery if you continue to take warfarin till the day of surgery. So what we do is we stop 5 days before the surgery, and we will replace that with another blood thinner called heparin, which has very short period of action. So we will continue the heparin till the day of surgery, the day before the surgery, and we'll stop that so that during the operation you don't lose a lot of blood. And but we will take care of you. We usually will take care of you in that period, and after the surgery, and we will again restart the heparin, and we will continue to see you, and then we'll slowly will start both warfarin and heparin, and if we are satisfied with some thing, and we will ask you to take the warfarin till the rest of your life. So
Okay.
are you with me, or do you
Yeah,
have any
yeah,
doubts?
doctor. Yeah. No, no, it's fine. I now I understand what you mean. So you said that you're gonna stop warfarin, give me another medication that is short acting, and then restart me in warfarin after the surgery. Yeah, now actually it makes sense now. Thanks for explaining it in this way. Um, but will you start me in warfarin immediately after surgery, or later on?
Yeah, immediately no, immediately after surgery. So we will start the heparin first, and we need
Yeah.
once after 6 hours, something like that. If you're satisfied that you no more bleed after the surgery, so we will start this heparin, and once you're allowed to take some normal fluids, we'll bridge this with the warfarin. So we will take some tests, blood tests, to see that your breath thinning effect has attained. So once we are satisfied with that, then we will stop the heparin, which we started earlier, and we will continue with the warfarin. So it is just
Okay.
to, we're adjusting the things to prevent loss of blood during surgery. And
I
you
don't
do
know,
not
doctor,
don't
but
have to worry.
this seems like lots of medication going in, and I'm not sure if I'll be able to handle this on my own.
Yeah, sure. I understand your concerns, and we will usually ask you to come to hospital some days before the surgery, when we are going to stop the warfarin and stop heparin. So we will take care of you. So we will take care of you, so that you do not have to worry about. Our team will take care
Okay,
of you.
that's a good idea. If you're
Okay.
gonna admit me before the surgery, yeah, that should be right. Okay, I just need to ask, since we're talking about medications to stop before the surgery, I also take diazepam. Do I need to stop that?
Uh, I don't think so. You can take the diaphragm with a small sip of water, even on the morning of your surgery, and it should be okay with it. But anyways, I will I will take an opinion with my consultant or with an anesthetist, and you will be duly informed before the surgery. We will
Okay,
be informing you what to start and what to everything
okay,
about.
okay,
Okay.
that's fine. Thank you very much, doctor. That's really clear.
Okay. So, do you have any other questions
No,
regarding? Do you
that's
have
it.
any other
Thank you.
concerns? Do
No,
you have any
that's
other
it. Thank you.
concerns?
No,
Okay, thank you very much. If you want to ask any doubts, so I leave my number with my nurse. So you can all, I'll be happy to come and discuss with you about this situation. Okay,
sure. Thank you.
thank you very much.
Thank you. All right, Hamad, what do you think of your performance in this one?
Uh, I don't know, sir. Actually, last time I haven't done well, so I was actually seeing all your uh, videos, and I was just doing by myself. And
Mm,
actually, it's not helpful. I just joined that course, of YouTube course. I just paid some amount, and actually, it is very good for me.
okay.
I don't know. So, do you have to give the inputs? So, what are the things I have to
Yeah, I'm
improve?
gonna, of course, I'm gonna give you the inputs, but I just wanna see. To be honest, I see significant improvement from the last time. You've done really well in this one. All right, it's much
Okay.
better. You're very calm. You're taking your time to answer questions. You're listening carefully. So I'm very, very happy with your performance in this one. Okay, so
Okay. Okay.
there is no much negative comments. The only thing is, at the beginning, you did not confirm my name and date of birth. You need to do that.
Oh,
Yeah.
okay. Okay.
So you didn't
Okay.
say what's your name and what's your date of birth. This is very important. Okay. And
Okay.
you established my understanding. You explained warfarin quite well, but you took so much time explaining it. By practice, it will be shorter. So what you need to say is, here,
Okay.
you need to say, warfarin is, of course, a blood thinning medication, and I'm sure that you understand that, to prevent you from having any blood clots or heart attacks or even a stroke, which is a significant medication. That's why I understand that you're very concerned that we're stopping it. But at the same time, if it thins the blood, it can cause significant bleeding, especially if you're having surgery. All right. And I
Okay.
mean,
Okay.
if you give a chunk, so I gave a chunk, I would say, are you following, sir? It will say, yeah, yeah, yeah. So there is a higher risk of bleeding. And also, warfarin is a very long-term medication. Your body takes around 3 days to clear the warfarin. So if we stop it today, we cannot really have surgery until 3 to 5 days from today. And that's why we need to stop it, to prevent you from having bleeding during the surgery. But I'm gonna take you back to the risk of the stroke. If we stop it, there is a risk of stroke. That's why we're gonna introduce a new medication to you that's called heparin. It works in the same way, but it's a short action medication. All right. You don't have to go
Okay.
in detail about the science of how does each medication work. You don't have to go in detail about that. All right.
Okay. Okay. Okay.
No, all right, that's fine. But otherwise, you've done really well in this scenario.